Disclaimer: this video is for educational purposes only. There is no doctor-patient relationship formed through this video. The video content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. The authors hereby disclaim any and all liability to any party for any direct, indirect, implied, punitive, special, incidental, or other consequential damage arising directly or indirectly from any use of this video, which is provided as is and without warranties.
My name is Dr. Ernest Chesina, and this is Dr. Udell Edelstein, co-investigator in a study that was performed along with Dr. Ernest N. Chesina and Dr. Afshin A. Atishvani.
The study demonstrates that applying 40 millimeters of mercury of localized external pressure to the biceps muscle using a specialized fracture brace with simultaneous isometric muscle contraction produced a statistically significant increase in the muscle deoxygenation when compared to isometric contraction alone. The deoxygenation was 3 times greater with simultaneous pressure and muscle contraction. This video is to make clear how the testing was performed. Changes in the oxygen saturation will be read off the Neuro 200NX and also recorded by the device. This is the emission and detector probes fixed in the rubber probe holder, which ensures 4 centimeters of separation. The rubber probe holder is embedded in the deforming element to lie flush with its contact surface. This is an axial view of the modified specialized fracture brace. This is the sphygmomanometer fixed to the brace wall with Velcro. These are its tubes for inflation and pressure measurement. This is the deforming element fixed to the sphygmomanometer with Velcro. This is the rubber probe holder fixed in the excavation of the deforming element. This is the emission and detector probes in place in the rubber probe holder. 5 measurements are required, including event 1 through event 5.
This is event 1 with the deforming element on the mid biceps. The oxygen reading is plus 6.8. This is event 2 with 10 pounds of load with isometric contraction of the biceps. The oxygen 3.8. This is event 3. The brace is in place with the sphygmomanometer overlying the deforming element, no pressure being applied, and no muscle contraction. The biceps muscle is flaccid. The oxygen measurement is plus 0.8. This is event 4 with 40 millimeters of mercury pressure being applied with the sphygmometer. The biceps muscle remains flaccid. The oxygen measurement is minus 15.4. This is event 5 with the pressure being maintained and isometric contraction beginning with 10 pounds of load. The oxygen is minus 30.
This is a summary of the oxygen measurements for the 5 events. The deoxygenation resulting from isometric contraction with 10 pounds without any external pressure being applied was approximately 3.2 micromoles. The deoxygenation resulting when 40 millimeters of mercury pressure is applied with the modified specialized brace with simultaneous isometric contraction with 10 pounds was 30.8 micromoles.
So we've shown here today a clear drop in oxygen after the application of the external pressure device and muscle contraction. We demonstrated a clear, large drop in the muscle oxygenation. The drop was about 10 times greater with both the muscle contraction and the extrinsic compression. So this would imply that there's decreased oxygenation with applied pressure and simultaneous muscle contraction. This can be very important in the setting of fractures. If someone were to have a fracture in the proximal humerus and someone would apply an external pressure and ask the patient to cyclically contract the muscle, theoretically the muscle oxygen should go down drastically and in a cyclical manner. So if someone were to have a fracture in the proximal humerus and someone were to theoretically apply an external pressure over the fracture site and ask the patient to cyclically contract the biceps muscle, the oxygen tension in the muscle should go down and should also go down near the fracture site. As noted from prior studies, on a cellular level, it's well known that cyclic hypoxia helps fracture healing. And so if one would apply the external pressure and the muscle contraction, one could invoke a focal area of cyclic hypoxia and theoretically should help fracture healing. This can explain a prior study that we've done. We have a pending publication now of 2 patients, of older patients that we applied this pressure device and asked the patient to cyclically contract the muscle, and both patients healed well, who otherwise would not have been expected to heal properly due to multiple risk factors. Sarmiento has a well-known theory that micromotion at a fracture site explains fracture healing. From the data that we have shown here and from the prior studies that we have done, it is possible to invoke the isometric muscle contraction plus external compression causing a cyclic hypoxia, causing the fracture healing that was previously seen by Sarmiento, and may provide an alternative explanation for the fracture healing.
Comments or questions can be addressed to Dr. Chesiner at the following email and to Dr. Edelstein at the following email. We would like to thank the Hamatsu Photonics Corporation, KK Japan, for making available the Neuro 200NX spectrometer. Disclosure.